Hi, good afternoon, everyone. My name is Wan Chin, and to my left is actually Dr. Liu. So, Dr. Liu is an endocrinologist, and I'm a senior podiatrist. And today we'll be speaking to you regarding diabetic foot care. So, thanks for joining us again. So, we'll be sharing on some things. Firstly, is the essentials of diabetic foot care, some preventative strategies that you can employ to prevent foot complications, as well as the type of footwear that you should be using in order to avoid these complications. So we all know that diabetes means that we probably have too much sugar in our blood, but how does this actually affect the leg? Unfortunately, high blood sugar levels can cause damage to the blood vessels and to the nerves as well. So the high blood sugar levels can cause plaque to build up in the inner lining of the blood vessels, which can block blood from reaching their legs and feet. This can result in your skin becoming very thin and fragile, thus it is much easier to develop wounds. If there is a wound, there can be some difficulty experienced with wound healing, resulting in gangrene, where parts of your foot may start to turn purplish or black in appearance. Some people may also feel some cramping pain in the back of your calves and thighs after walking for short distances. When diabetes is poorly controlled, your high blood glucose levels can also damage the nerves, causing them to lose their functions. There are three types of nerves that we have in our body, and they are known as the sensory nerves, motor nerves, as well as the autonomic nerves. When your sensory nerves are damaged, you might start to feel weird sensations such as numbness, tingling, burning, or even electric shock sensations across the feet that tends to occur more frequently at night. You will also be unable to feel pain when you step on sharp objects or develop wounds. On the other hand, damage done to your motor nerves can cause degeneration of your muscle tissue in your feet, causing the formation of foot deformities, and it can impair your ability to carry out normal walking activities. Lastly, we have autonomic nerves that help to regulate the secretion of sweat and oils that keep our skin nicely moisturized. So damage to these nerves can cause the formation of very cracked and dry, scaly skin. So now we know that diabetes can affect our circulation and sensation. The question is really, how would a person with diabetes know if he or she has any problems with their circulation or nerves? Thus, a big component of diabetic foot care would be attending diabetic foot screenings where clinicians can help you assess this. You can do this at the polyclinic or hospital, and based on ministry guidelines, these visits should be regular, with the frequency ranging from once every 3 months to a year, depending on the person's risk status. So a diabetic foot screening would consist of a blood circulation and sensation check of your feet. To check for sensation, a thin plastic filament will be used by the clinician to press on various locations of your feet. Sometimes a machine will also be used to test how well your feet is able to feel vibration. To check for circulation of your feet, sometimes clinicians will try to palpate your pulses, and sometimes machines will be used for further investigations as well. In the event that you cannot feel the filament touching your feet, this means that you may not be able to accurately sense pain or temperature differences, such as differentiating hot from cold. Hence, we strongly advise against going for foot massages or soaking your feet in hot water. You should also check your feet daily for any injuries and use footwear in order to protect your feet from injuries that may be caused by small sharp objects or even hot towels on the ground. On the other hand, if you are unable, sorry, on the other hand, if you are assessed to be unable to sense vibration well, this means that you might face difficulty in controlling muscle movements and moving around smoothly in a dark environment. You may also experience a reduced sense of balance, increasing your risk of falls. As such, it will be really important for you to be able to have some night lights or maybe install railings at home or even use walking aids to reduce the risk of falling. In the event that you have reduced blood supply to your feet, you might have impalpable pulses. Diagnostic measurements such as pressure readings at your toes could also show very low pressure readings as well. Like what we mentioned earlier, poor blood circulation can cause tightness or cramps at your legs or even the buttocks when exercising or walking short distances. If you have wounds, poor blood circulation may affect your wound healing as well, and it's really best just to prevent any foot traumas. But if you have any wounds or injuries observed, you should definitely seek medical attention as soon as possible. You are highly encouraged to attend your diabetes foot screening appointments, as early detection and management of diabetic foot complications can save you from an amputation. Statistics have showed that if you have not attended a diabetic foot screening for the past 2 years, you are 3.5 times more likely to get toe amputations and 26 times more likely for major limb amputations. Apart from direct injury to the skin, hard skin formation like your corns and calluses are often the precursor to diabetic foot wounds, also known as foot ulcers. So one way of thinking what exactly corns and calluses are would be that they are like breast lumps. Similar to breast lumps, corns and calluses are hard lumps that can be not painful. Also, like how some breast lumps could be indicative of something negative, such as being cancerous, some corns and calluses can also indicate the presence of dangerous foot ulcers. So how do all these corns and calluses come about in the first place? So following damage to your motor nerves, it can actually result in muscle imbalances and foot deformities to form, which results in some areas of your foot experiencing high pressure. The skin then tries to protect itself from these high pressures by forming these corns and calluses. In addition, dryness of the skin may further increase friction, which causes the corns and calluses to form as well. In a person that has good sensation on the foot, calluses or corns are often uncomfortable and painful to walk on, leading to them to seek medical treatment. However, if you have diabetes and if you have damage to your sensory nerves, the inability to feel pain can allow you to continue walking comfortably without seeking treatment for the callus. And without treatment, there is going to be further buildup of pressure in the area, leading to the formation of even thicker calluses. And these thicker calluses, in turn, causes an increased pressure on the soft tissues underlying them and may eventually break down, forming a wound and appears as blood underneath the skin. With the diabetic foot ulcers, there is always an increased risk of amputation. And that's really because a lot of times patients delay the treatment of the wound because they are not aware of the wound due to poor sugar levels. Wound healing can be further delayed. This may result in actually deep tissue infection, and in the worst case scenario, amputation is required to control the spread of the infection. So now that you know the possible complications such as foot ulcers and amputations that can come about if you don't take good care of your feet, we're going to have a more in-depth discussion now about some solutions that you can practice to protect your feet. So firstly, it is extremely important that you check your feet daily, especially if you have a loss of sensation in your feet, since you might not feel any pain even if there is something wrong. So all parts of your feet should be checked, and this includes the space in between your toes, the back of your heels, and the soles of your feet. So do look out for any wounds, cuts, blisters, cracks in the skin, and changes in your skin color. If you have difficulty checking the bottom of your feet, definitely try to engage the help of a family member to assist you, or you can actually put a mirror on the bottom on the ground and then just tilt your feet a bit so as you can see the bottom of your sole. When your skin is dry and cracked, bacteria and fungus can also enter the skin and cause infections. Thus, it is extremely important for you to apply moisturizer to the top and bottom of your feet around 1 to 2 times a day to strengthen the skin. How much cream to apply is a question that we are actually commonly asked, and I would say that the rough estimation would be a size of a $1 coin. So that's how much cream that should be used for each foot. Take note that you should not be applying any moisturizer in between your toes, as increased moisture in these spaces can actually encourage fungal growth instead. You should also allow your moisturizer to dry before you put on your indoor shoes to prevent falls. Do remember to cut your toenails regularly as well, as long toenails can poke into the surrounding skin, causing wounds. When trimming your toenails, you should make sure you trim them straight across and use a nail file to round down any sharp corners. Do not cut down the corners of your nails, as you may risk leaving a sharp nail spike that can lead to an ingrown toenail. If you do have any calluses and corns, of course, if they are really thick and they show signs of internal bleeding, do see a doctor or podiatrist to have it assessed. And if they have already assessed it and is deemed to be mild, and does not need any podiatry treatment, then you can try self-managing them through regular filing using a pumice stone or foot file at least 1 to 2 times a week. Always remember to touch your calluses and stop filing if they are no longer thick. Another trick is to actually use a moisturizer to try softening the calluses and corns so they aren't so hard. Avoid using any acids or sharps like your penknife to remove your callus or corns, because excessive use of acids on healthy skin can cause your skin to be more fragile and susceptible to wounds. Using a blade like a penknife to remove your corns and calluses also exposes you to a higher risk of causing a wound, thus we do not recommend it. If you're not sure on how to proceed with filing your toenails and calluses, we have uploaded step-by-step videos onto the Tan Tock Seng YouTube channel that you can readily access. So you can scan these QR codes that are on the screen now to access these videos. In the event that you notice a wound on your feet, do not panic and do not try to cut any of these wounds or blisters. Instead, start with cleansing the wound with some saline or clean water, then apply an antiseptic solution like iodine on the wound. Although you may want to apply your favorite Qing Tao Liu or any other types of traditional medicines, unfortunately, these products are not proven to have any antimicrobial properties and may slow down your wound healing. Thus, it is advisable not to apply these products. Also, do remember that you should be covering the wound with a clean plaster or gauze after applying the antiseptic solution, and do not let it be exposed, otherwise you're increasing the risk of infection on the wound. More importantly, monitor your wound for any signs of infection. Check if the skin surrounding the wound has any redness, swelling, or is warm to touch, and check the wound for any pus, bleeding, or increase of fluid expressed. Signs are observed, you should see a doctor immediately. Similar to how abstaining from smoking can probably reduce your risk of lung disease, using good fitting, suitable footwear is also extremely important to avoid any complications to your foot. Because wearing poorly fitted shoes can cause complications such as the formation of your blisters, wounds, toe deformities, foot pain, and calluses and corns. But what comprises of good appropriate footwear? Firstly, good footwear should have both cushioning and supportive properties. Cushioning properties will include having thick and soft inlays, and the sides of the shoes should be constructed with soft materials that are not rough. The shoe should also be well padded around all edges. And you can actually self-check your shoe by actually running your hand along the inner lining of your shoe to check for any rough edges. Next, the shoe should be supportive as well, and there are two main supportive properties which we are checking out for. Firstly, the shoe should have a firm heel counter, and you can test this by pressing the back of your shoe. So it should remain firm and should not collapse in order to support your ankle well. Secondly, the shoe should also have a very firm midsole to support the arch. So you can assess this by trying to twist the shoe at the middle part, during which the sole should remain stable and it should not buckle, fold, or twist like what you can see in the images over here. Shoes should also have a lace or ankle strap that can help to hold and support the foot to prevent prevent your foot from sliding forward within the shoe when you are walking. So we often see patients who have blisters or skin abrasions or even toenail injuries that is caused by the foot sliding within the shoe. Thus, having some form of like ankle fixation is extremely important to minimize the risk of such injuries. Also be well fitted as well. And a well fitted shoe means that it should have at least one thumb's width spacing from the end of your longest toe to allow your toes to move. So do take note that your longest toe may not be your first toe, and instead could be your second and third toe. Also ensure that there is enough depth in the front part of your shoe, especially if you have clawed toe deformities. So to test this, you should be able to pinch up about 1 centimeter of material from the widest part of your shoe. This is especially important if you have any toe deformities, so as you can prevent the sides of your shoes from rubbing against these toe deformities. Some good practices to have when using footwear include using new shoes at home first for minimally 1 hour. So while using the shoe, observe for any signs of rubbing, redness, or blistering on your feet, which may suggest an inappropriate fit of the shoes. When trying to buy shoes, also try to do it in the later part of the day, as your feet tend to expand throughout the day. You are also encouraged to wear socks with shoes, and these short socks should not have any seams and should preferably be light colored as well, so that any blood stains can be easily identified. Before using your shoes, you should look into the shoe to check for any foreign objects. Ideally, in addition to like just checking visually, you should also try to stick your hand into the shoe and try to feel the inside for any foreign objects, as you may not be able to see the inside of the shoes clearly. Although very unpopular in Singapore because Singapore is quite hot, but using footwear at home is equally as important as using footwear outdoors, as you still need to protect your feet when you're walking around at home. So if you're someone who is low risk, so it means that you have good circulation, good sensation, you don't have any pressure points with severe callus growth, you might want to consider just using anti-slip soft cushioning covered slippers. However, if you're someone with a history of a foot wound, you have poor circulation or sensation, or you have areas of your foot that is prone to growing thick calluses, then you should be considering using more supportive forms of cushion sandals like the ones that you can see in the slide here for the high-risk foot. So Crocs and slippers are very popular styles of footwear that I use because they're very easy to use and they're quite airy as well. However, you should really avoid using this kind of footwear as they are likely to cause rubbing and knocking injuries. So in conclusion, what we have just gone through are just some good habits to pick up and practice. And I understand it's quite overwhelming, especially if this is the first time you're hearing of all this, and you're probably thinking, how are you going to practice all of them all at the same time? Thus, what I would suggest is that you can actually try to pick one thing that you can implement in your life. So for example, you can just try to do daily foot checks first. And once you're able to do that, you can try to slowly incorporate the other parts into your life as well, and it will be much more manageable. So it's difficult, but it's definitely doable because we have many patients that are able to do it. And if you need help, don't hesitate to approach your doctor or your podiatrist with any of your queries. And if you're interested to find out more, there's really an excellent resource of educational materials on the diabetic foot that is readily available online. So it's very comprehensive with a wide range of topics ranging from what we discussed today about diabetic foot care and footwear to other issues such as ingrown toenails and bunions. And you can just scan the QR code on the screen now to access these materials. And that's all from us today. Thanks for joining us.